Hi, I'm Paul Carruthers, and I am a nurse consultant at the CQC registered Gender Plus Hormone Clinic. I am joined by my two esteemed colleagues. Claudia, would you like to introduce yourself?
Yeah, hello, I'm Claudia Zitz. I'm a consultant clinical psychologist and systemic psychotherapist.
Thank you. And Aidan?
I'm Aidan Kelly. I'm a consultant clinical psychologist and director at Gender Plus and Gender Plus Hormone Clinic.
Thank you. So we have put together a session to talk about transfer of care. We're getting lots and lots of questions coming in asking us, will we accept transfer of care? So we thought we'd put together the most commonly asked questions. If there is anything that we don't cover, then please get in touch. You can email us at admin@genderplushormoneclinic.com. And equally, you can also go to our website where we try to update it as much as possible. And that's www.genderplus.com. So, Claudia, I think you've got the first question. I might leave this one for you.
Yeah. So one question that came through is, I'm interested in transferring my care from my current provider to the Gender Plus Hormone Clinic. So how do I go about it?
Thank you. Well, first of all, we do accept transfer of care, and to transfer your care to Gender Plus, and specifically the hormone clinic to see me or another member of the medical team, then you can self-refer using the website. You'll then have an appointment with a member of the psychosocial team, and typically this might just be one appointment, but it will differ depending on individual circumstances. Then there is a transfer of care or a referral rather into the hormone clinic with myself, and then there will be another consultation where we chat about your individual circumstances, and hopefully at this point we'll be able to take over prescribing your hormones.
Thank you. And Paul, how much does it cost to transfer the care over to you?
So each assessment will cost £275, or if you're in Ireland, that's €320. So one appointment with the medical team, and prior to that, an appointment with a member of the psychosocial team. Aidan, I think you might have a question for me. We're sharing them out here.
I do indeed. I do indeed. This is very exciting. If all goes well and you accept me as a patient, what happens then?
So, good question, and that's definitely a common one that we're getting in our inbox. So, if you've been on hormones for a year or more, it is unlikely that you will require as much input from our team as opposed to those that are new coming through our service. So, therefore, an annual subscription of care should be sufficient to monitor your health and well-being as opposed to the 24-month model that we provide for new patients. The practicalities of prescribing will vary patient to patient, and I don't think it's fair to sort of go into all the different examples here. So we would discuss those during your appointments and be able to provide that information depending on your own circumstances. Does that answer your question, Aidan?
Just thank you very much, Paul. Very clear.
I've got a question for you, Claudia, actually. So when they come over and they bring hopefully all their paperwork and any previous assessments from another provider, what might happen if that session is inconclusive?
Okay, so I guess we really want to provide you with the best possible care, and therefore, if that single session is inconclusive, the clinician that's involved in your care may recommend further assessment.
Thank you. And I know sometimes it's how long is a piece of string, but people are interested to know sort of how long a transfer of care process might take. I'm not sure if you're able to sort of answer that and give a rough timeline.
So one of the great things at the moment with our services that we've got kind of a reasonable amount of capacity to see people quite a kind of a timely way. So those two appointments, should be able to happen within a couple of months of referrals. So quite quickly, really.
Brilliant, brilliant. And what is the ongoing cost of treatment with the hormone clinic? We've talked about how much the assessments cost, but how much does the ongoing care cost?
So yeah, as you mentioned, for the transfer of care patients, their input would likely be kind of reduced or less because they will have already been on treatment. So our monthly subscription costs also reflect that. So they would cost in the UK £40 or €45 in Ireland per month for the amount of time that someone's under our our care. So, yeah, so it could be around a year. And that's kind of opposed to the £80 or €95 in Ireland, kind of monthly subscription at the moment for people who are just starting on treatment. So yeah, that's so 40 or 45, depending if you're UK or Ireland.
Brilliant, thank you.
Paul, I've got a few questions for you. Do you take Zitz referrals?
Yes, we're very happy to take referrals from Zitz. Again, this will depend on individual circumstances. So has a diagnosis been made? How far were they into their own assessment? Have they started on endocrine treatment yet? So the answer is yes, we would. And what we will offer will very much depend on how much input they've had from Zitz.
Okay. And do you take referrals from other providers as well?
Yeah, we'll take referrals from any other provider, providing there is evidence that they have had baseline investigations and monitoring bloods whilst they've been on medical treatment, and we will ask for those to be supplied for their first appointment with myself.
Okay, thanks. And Paul, are there any age restrictions on the transfer of care pathway?
So at the moment, our UK hormone clinic is currently available to those aged between 16 and 25. For the transfer of care pathway, what we're talking about today is primarily for those that are between 18 and 25. We will be looking to expand the upper age range over the coming months. For those that are on treatment between the ages of 16 and 18, then their circumstances are slightly different, and we just ask that you get in touch with us on our email address, admin@genderplushormoneclinic.com, where we can discuss individual circumstances.
Right. And Paul, what do I need to transfer my care to the Gender Plus Hormone Clinic?
So I just mentioned this before, you must have a summary of your care documents, so any previous gender assessments, evidence of any blood monitoring that's taken place while you've been on hormones, and I will also need to see a copy of your prescriptions, and that will all be discussed with you when you come for your first appointment.
Right.
Right. I've got a couple of questions for you, Paul. I think some of these may have been already mentioned, but I'll ask them anyway. Do you accept transfer of care requests for those aged 16 and 17 years old?
We do, yeah. So I just mentioned this. We do absolutely take transfer of care requests for those ages, but the pathway of care that we offer is slightly different because we follow an adolescent model of care. So again, just get in touch with us at admin@genderplushormoneclinic.com and we can answer any questions you have about individual circumstances.
So, Paul, what are the chances that my NHS GP will agree to shared care with Gender Plus Hormone Clinic?
Okay, so far it's quite a high probability. For those that are coming through our service, GPs are entering a shared care at a rate of around 70 to 80%. There's a lot of reassurance out there that as the UK's only young person's gender hormone clinic to gain CQC registration, that what we're finding is most GPs are happy to enter into a shared care agreement with us. We can't give you a concrete answer whether your GP will or not. That's a conversation that you would need to have with your GP. And if we can support with that in any way, then just let us know. So can I flip it around then?
Right.
I'll get off the hot seat for a moment. So, Aidan, why is the transfer of care pathway more affordable than the standard pathway with Gender Plus?
It's a good question. So transfer of care patients will have already been on treatment for a period of time. And so the time needed on the hormone pathway is likely to be shorter, and the level of input from our hormone team will likely to be reduced as well. And also, I guess, the transfer of care pathway does not include kind of mental health or psychosocial reviews, which the kind of the initial pathway does. So there are some distinct differences to kind of cater for the different needs of each group, I suppose.
Brilliant, thank you. So typically we're going to offer a 12-month subscription model of care for those that are having a transfer. So what would happen after that 12 months?
So once your pathway with our service is complete, the team would, I guess, assess your readiness for discharge back to the care of your GP. They will liaise with your GP to support them, train them, or get them involved in the care to ease the post-discharge transfer process, so that they'll feel competent and comfortable to be able to continue your care in under the provision of the primary care practice, really.
Yeah, brilliant. So I guess with all this, we're really proud that we're a UK service, but also an Irish service. So is there any differences between the UK and Ireland when we're talking about a transfer of care?
I guess there are some slight differences. In Ireland at the moment, we do have capacity provision to see people of all ages from 16 and above. At the moment in the UK, we're just able to see 16 to 25-year-olds, although we are looking to very soon build in capacity to see those aged 25 and plus in the UK. So there's a difference in age range, I suppose. There might be some slight individual differences in terms of how different clinicians run and treatment regimes and these sorts of things, but basically they're more or less the same, really. But I guess it's perhaps worth visiting the FAQ section on the www.genderplushormoneclinic.com website. And there's two different sections there for UK transfer of care and Ireland transfer of care. And you can read the individual slight differences there if you want to know more.
Brilliant, thank you. So that's all our questions. To summarize, yes, in most cases, we will accept a transfer of care. If you want to know more about the individual circumstances of yourself, then please get in touch at admin@genderplushormoneclinic.com. You can visit our website at genderplus.com.